then we make the incision. We then move the muscle to the side and place retractors to look at the local anatomy. We then have to use an x-ray during surgery to make sure that we're at the correct level. Then remove the back part of the lamina in order to expose the thecal sac underneath. This animation demonstrates it by using something called rongeurs. But normally in this type of surgery, we use a high-speed electric drill, and we basically shave off the lamina from the thecal sac. The thecal sac is where all these nerve roots are located. They're responsible for things like movement and sensation. It's protected by a tough membrane. Comment if you know the name of it. Once the thecal sac is retracted, we can then visualize the herniated disc if you have one. Otherwise, if you need a fusion surgery, we have to use a knife to remove some of the disc. We then have to replace what was removed with an artificial spacer because you can't just have a big empty gap there. At this point, we then place titanium screws into the spine in order to stabilize it. The titanium rods are then placed into the screw heads and secured in place with something called set screws. We then clean up the surgical field and coagulate any open blood vessels. Retractors are then removed, and then we reapproximate the incision with sutures. If you've ever been told you need spine surgery, or if you've ever had spine surgery,